The state epidemiologist says the COVID-19 pandemic in New Hampshire is at its worst point yet, and the only bright spot is that vaccines are heading off even more death and suffering.
We have one of the highest levels of COVID in our state right now than at any other point during the pandemic, the highest level of hospitalizations, one of the highest levels of deaths due to COVID-19.
Governor Chris Sununu continues to ratchet up the state response, announcing today another booster blitz on January 8th and a contract for up to 6 more fixed vaccination sites going before the Executive Council next week to try to ease the demand pressure on pharmacies that are currently scheduling appointments into January. The state is also continuing work to free up hospital beds currently occupied by long-term care patients who can't get back into facilities due to staffing issues.
We've already moved over a dozen patients or something like that in just the first few days.
The governor also visited Elliott Hospital this morning, saying the big takeaway for him was the amount of ICU care being displaced by COVID patients and the plight of those patients, the majority of them unvaccinated, facing a life or death illness without friends or family by their side.
I can guarantee you none of those individuals we saw today thought they would be in that position a few months ago. And there they are. And that was just one hospital out of 26. And so that gives you a real perspective over the scope of the issue that we're dealing with.
And tonight, the governor also said he's working to try to keep the FEMA surge team of healthcare workers that's currently in the state here a while longer. But he noted that there are other parts of the country now seeing intense COVID surges in their hospitals, and it's likely that that team will have to go elsewhere when its time in New Hampshire is up. Reporting live in Concord tonight, Adam Sexton, WMUR News 9.